Members who worked at the Orsmond Tuberculosis Hospital in Kariega in the Eastern Cape are still getting paid despite the health facility closing doors almost 2 years ago. DA member Jane Cowley posed a question in the provincial legislature asking the health department about the 45 medical employees and the 67 million rands in wages. Cowley joins us now for more on this conversation. Jane, good to have you, and thank you very much for your time. What led you to this particular story and to the questions that you then put to the MEC?
Thank you very much for having me, and thank you. Good evening to the viewers. What led me to ask the question was I am very dedicated to doing oversight across the province in our health facilities, because I feel, this is where at grassroots level, this is where people really get affected most. And so I do a lot of oversight at the hospitals. I was at Orsmond Hospital 2 years ago when, the discussion had come up that the hospital was going to close because of the underutilization of the facility. And this was twofold. Firstly, COVID had sort of petered out at that point. They weren't using the facility for COVID anymore. And secondly, because lots of medications for chronic illnesses such as tuberculosis were now being delivered to people's homes and close by close by to where they lived, people didn't have to come to the hospital as much. So the numbers, what they call the bed utilization rate, had dropped dramatically. And because there was another tuberculosis hospital in the district, they felt that they didn't need both of them. So I knew that the hospital was going to close, but I was most surprised last year when I learned that there was still staff there. And then I conducted oversight there at the end of last year, and to my surprise, there were still staff there. So I set a question this year around the fact that there are still staff there and, why? And, the answers were rather shocking to me, I must say.
Yeah. So there are people who are reporting for work. They go to the hospital.
Correct. So there are about 45 staff members that are getting paid full salaries for not working at all. Some of them are medical doctors, some of them are nurses, some of them are administrative staff. Some of them check in every day, some don't even bother because they know they're going to get paid anyway. So to my mind, this is just morally reprehensible, especially from a department that is so financially hamstrung at the moment and struggling to deliver services at the best of times because of their financial constraints. And then to waste money on paying salaries to people who are not even delivering the service that they are employed to deliver is, to my mind, not acceptable at all.
So was there a plan as to how the winding down would be carried out with specific time frames as to when it's going to start and when would the complete process be done and no staff should at that point be at the facility?
Well, my understanding was that according to the HOD's answer to the question, that they had had negotiations with the unions, and the unions had agreed that all staff members at the facility would be reallocated to nearby facilities that were short-staffed. Now, every facility in the Eastern Cape is short-staffed, so there was no shortage of opportunity for these employees to go elsewhere. However, it seems that 45 of them now dug their heels in and decided that they hadn't been fairly represented. But the time frames were that, right at the beginning when the hospital closed, that they'd all be sort of reallocated to different facilities. So the fact that this has gone on now for almost 2 years is absolutely unacceptable, because it's 2 years of other facilities not having staff members that they could have had. They could have contributed to healthcare service delivery in our province.
Yeah. So by all accounts, you're saying by around mid-2021, the process should have been completed of winding down that facility.
Yes. Well, look, the last patients they had at the hospital were in October 2021. So to my mind, a reasonable time period would have been the end of 2021 or very early in 2022, just for pure administrative purposes. But certainly not a year and a half later.
Yeah.
It's just quite crazy.
I just find it quite strange. I mean, so what do they do? There's not a single patient. They have no work whatsoever. They just go there every single morning, 45 of them. And what exactly do they do there? What did you find when you went there?
Well, I just wonder how people can do that and earn a salary without a conscience. It's beyond me. They literally go and sit in the sun and chat, or some of them don't bother to go at all. The sadness is, though, that in this facility, there was a ward that was renovated for the COVID pandemic. So there are beautiful brand new beds in that ward. There's an excellent X-ray machine there. And without that facility being used and without those resources being repurposed and taken elsewhere for use, they're going to be vandalized or they're going to break. And what a waste. So not only are human resources now being wasted, but also actual medical resources that could be used in other facilities are now just going to go to rack and ruin because the department has not managed to manage an HR situation.
And what is the indication then from the Department of Health as to what is the future, one, of that building, two, of that infrastructure, and then three, of that 45-strong staff complement that is being paid 67 million rands?
Well, the head of department did not elaborate on the building itself. Many parts of the building are actually very old and would require a lot of maintenance. But the ward that they had renovated was perfectly usable. However, the facility itself is old. She did, however, indicate that the whole issue would have been resolved by the middle of June. So I sent this question in April. I got the response in May. So I assumed that by June she would now have resolved the issue. And of course it has not been resolved because they're still there. So I just feel as though in a department where we are so short of resources, whether they are financial, whether they are human, whether they are medical equipment, whatever, this is such a waste of resources, and we cannot afford this wasteful expenditure in the Department of Health in the Eastern Cape, a department which, keep in mind, is already factually bankrupt, that does not have a cash flow. So to go and throw 67 million at people who are not doing their work it's quite morally reprehensible, quite frankly.
Yeah. So I suppose then there are two, maybe even more levels here. One would be the Department of Public Works. I suppose that would eventually become the custodian of that building. I'm assuming it's a government building, and they would need to use it for something else. And then there's a Department of Health that owns something like those X-ray machines that could be taken to other facilities and be put to good use. And then there's the human resource issue, which would need to be addressed.
Yes, and and I think it's the same in all provinces. We have such a crisis with mental health, and we do not have enough facilities for mental health users and mental health patients across the country. One would think that the Department of Health would allocate, or take a facility like that can't be used for one specific purpose anymore, repurpose it, and use it as a facility for mental health care patients who are desperate for beds in a facility. As we know, so many of our mental health patients are walking the streets because there's just absolutely no space for them, and the system seems to reject them. The 24-hour observation periods are abused, and there are not enough beds in the mental health hospitals. So there are so many different things that they could have used this facility for had they planned accordingly. But unfortunately, planning doesn't seem to be their forte.
Is there some degree of urgency that you're seeing on the part of the political head on this matter to get things moving?
Well, I have written to the MEC and I'm hoping for a response this week, and she is usually responsive. So I'm hoping that they will take this matter seriously because, this is taxpayers' money, and taxpayers want to see how their money is being spent. And this, to me, and to everybody, I'm quite sure would be in agreement, is an absolute waste of resources, where we have so many shortages, and we have a food crisis, we have cost of living crisis, we have so many other crises to deal with, to then waste 67 million rand on people who are not prepared to do what they were employed to do in the first place it needs to be addressed really as a matter of urgency. And I sincerely hope the MEC will address this matter urgently.
Jane, we sincerely hope so. We did reach out to the MEC and her department, and we are hoping they will also come on board and give us some kind of response to what actually is happening and what is behind this labor relations issue and the wastage that you're pointing out here that could be put to better use within the province. That's a DA member of the Eastern Cape Legislature, Jane Cowley.